Hello guys, I hope you are. Today we're going through some important Gphc exam topics. So first and foremost, I wanted to start with ACE inhibitors. So let's talk about ACE inhibitors. An ACE inhibitor is any drug that ends with PRIL, so prils. That's why they're referred to as prils. So how does ramipril work, which is sort of the main ACE inhibitor that is dispensed or prescribed? So ramipril works by blocking an enzyme called angiotensin converting enzyme. So when you block angiotensin converting enzyme, you will prevent angiotensin 1 from being converted to angiotensin 2. So when you prevent that, or you block that, or you inhibit that, or you antagonize that, you will lead to a depleted amount of angiotensin 2, a reduced amount of angiotensin 2. So when you reduce the amount of angiotensin 2, you will reduce the amount of aldosterone as well. Now, why is that important? Because aldosterone is responsible for potassium excretion. So because aldosterone will allow potassium to leave or go, a reduction in the amount of aldosterone will increase the potassium levels, therefore causing hyperkalemia. Now, ramipril can also cause cough, and it's believed to be linked to bradykinin levels. So an increase in bradykinin levels can lead to a persistent dry cough that prevents you from sleeping. Now, an additional issue is angioedema. So patients taking ramipril can also experience angioedema, which is swelling or elevation of hepatic enzymes and jaundice. So angioedema, you would need to ideally change to amlodipine, which is a calcium channel blocker, used for hypertension. And if it's a cough, you would change to an angiotensin 2 receptor blocker. So if it's elevation of liver enzymes or jaundice, then you would halt the treatment. So now we get on to monitoring. So what monitoring points do we expect to see for ramipril? So we expect to see renal function and electrolytes before initiation, 1 to 2 weeks after initiation, and regularly throughout treatment. And that is very, very crucial. Now, on to interactions with ramipril. Ramipril can cause hyperkalemia. So any drugs that can cause hyperkalemia as well is going to be problematic. Now, when it comes to hypokalemia, you can expect to see loop diuretics, thiazide diuretics, macrolides, and there are many, many other drugs like beta-2 agonists and theophylline, which is also an interaction. So be aware of that when you're studying. Thank you so much.